Hi, Medicare Dana here. Medicare's AEP Annual Election Period is just around the corner, October 15th to December 7th. So wanted to give you some resources, talk through a couple things that you're going to hear, how you can prepare best. Medicare's AEP can be a confusing time for a lot of people, so wanted to give you some resources now so that you can anticipate what you're going to start hearing and seeing on television, on radio, and even from people calling your homes. So first, Medicare's Annual Election Period, AEP. There's a couple other names you might hear: Medicare's Open Enrollment, Coordination of Benefits, Medicare's Annual Election Period, or some people say Enrollment Period. It's all the same period of time, October 15th to December 7th. This is the one time of year that you can change, enroll in, or disenroll from a Medicare Advantage, which is Medicare Part C, or a prescription drug plan. So if you are on a supplement plan under Original Medicare, and you would know that because your plan would have a letter like an L, M, G, F. If you're on a supplement plan, nothing changes to your benefits. The supplement plans are standardized. So what that means is that they are not renegotiated. The benefits, the coverage is not renegotiated each year. You don't have a lock-in period either. You can make changes if you're on a supplement plan any day of the year. But Medicare Advantage plans and Part D prescription drug plans are renegotiated each year, and they have a lock-in period. And this is the one time of year that you can make a change, and then this will affect the benefits of next year. So open enrollment, October 15th to December 7th. Any changes you make now or during this time are going to become effective January 1st. So here are the 5 actual tips that can help you as you start preparing. The first is, do not make any changes without talking to an agent. And if you don't have an agent, there are plenty of us in the community that are well respected. Many of us are nationwide licensed, so we can help in multiple states, and that can give you unbiased information and guide you through. Now, if you don't have an agent, it might be because you went direct to an insurance company to get your supplement plan or your Advantage plan originally, so you probably don't have a dedicated agent, and you probably don't have a dedicated unbiased agent. Or some of you may have enrolled, and the agent that you enrolled with, you've never heard from again. So for all intents and purposes, you really don't have an agent, if that. You want an agent that is going to be dedicated to customer service, that calls you, that checks in on you, that you have their phone number, that when changes happen in the Medicare system, when changes happen within the plans, they're letting you know, and who you can call with any questions, and particularly who during AEP is reaching out to you. So again, if you don't have one, don't worry. A lot of people in the community are able to give resources. Ask your friends, ask your colleagues, ask your doctors, your pharmacists, your financial planners. Agents are very willing and wanting to help to answer any questions about Medicare. So hopefully that will help you, especially if you feel a little overwhelmed by not having one. So first, don't do anything without talking to your agent. Second is, it's so important to know which Medicare plan you're on. There are 2 ways to get Medicare: either Original Medicare and a supplement, or a Medicare Advantage plan. Knowing which plan you're on is going to help determine what type of changes you need to make. So it's very important to know. If you don't know what kind of plan that you're on, there are 3 ways that you can address this. First is you can log into your Medicare.gov account. If you don't have a personal Medicare.gov account, you need one. I've got a step-by-step guide on my website, MedicareDana.com, that can walk you through it. It's a pretty seamless process, but the Medicare.gov account is going to have all of your information: your doctors, your medications, your payments for Medicare, which plans you're on. You can print your cards. It's all there, and that's your information. It's a wonderful resource for you. So that would be the first route to check your Medicare.gov account. Second is you can call Medicare, 1-800-MEDICARE, and they can look up which plan you're on. And third, of course, is to call your agent, who will also be able to remind you which plan you're on. The third tip I would tell you is, don't believe everything you hear and see. I mentioned it earlier, but want to stress it here. You are going to start to hear so many advertisements, radio and television, and many times they talk about blanket statements of free services, or you'll get money back from your Medicare. And unfortunately, a lot of times they're talking about one particular zip code or one area or limited population of people that might get this service, but they say it in a way that makes you think everyone gets it. So before you make any decisions or feel panicked or feel like there's an urgent issue that you need to address because you heard it on the television or radio, again, I'm going to tell you, go back, talk to your agent. They will walk you through and be able to tell you if that's accurate or not, and potentially demyth anything that you might hear. So just don't believe everything that you hear and you see. The fourth thing, and I talked a little bit about it, supplement plans. They are standardized. They're not part of this annual election period. However, if you're on a prescription drug plan, a standalone prescription drug plan, you do need to pay attention and check in with your agent and review your options. The last thing is that you are going to get, you should get in your mail, if you're on a Medicare Advantage plan or a prescription drug plan, you're going to get an annual notice of change. Those are going to go through all of the changes that would occur if you stayed on your plan. So look out for that in the mail. The AEP period is specific for Medicare Advantage and prescription drug plans because those are renegotiated every single year. And every year you get this annual notice of change in September that tells you all of the changes. It might be to the premiums, it might be to the benefits. Maybe one year you had a benefit coverage and this year you're not going to your network of doctors. If you're on a Medicare Advantage plan, maybe some of your Medicare doctors that you see are no longer in the plan, so you wouldn't be able to see them. It could be the drugs that are allowed on the plan are no longer going to be covered. There's a bunch of different things that you could see in the changes that occur year to year. So pay attention to that. If you didn't get an annual notice of change and you talk with an agent, they can go over all of the changes because during AEP, those new plans are released from the Medicare Advantage side and from the prescription drug side. So that can get reviewed with you. And then bonus tip, don't wait until the end. The annual enrollment period is October 15th to December 7th. Do not wait until that last week in December. This is the busiest time of year for Medicare agents, for Social Security, and for the insurance companies. Expect delays, anticipate delays. Sometimes the websites even crash because everyone is looking at the same time. So ideally, my professional tip and goal would be to get your AEP taken care of before the Thanksgiving holiday. Meet with an agent, a Medicare agent, and ideally an independent agent. That way they can shop multiple carriers, multiple plans. They're not tied to just one insurance carrier. Instead, they're tied to you, the client, and they just want to make you happy, so they want to give you options. Meet with them middle of October so that if you do have a plan that you want to enroll in, you have enough time to go through the process, get things submitted, be able to anticipate the delays of both Social Security and or the insurance company, and then get all your documents in place going into the end of the year holidays. So those are my tips. There are more videos and resources on my website, MedicareDana.com. We are always happy to help answer questions, navigate anything that you need, especially during AEP, but year round.